Senator McPhedran.
Thank you very much, Your Honour. Senators, I had the great pleasure to meet with Manitoba Chief Derek Nepinak and other First Nations leaders recently during the Assembly of First Nations Winter Assembly here in Ottawa to discuss critical issues regarding funding for First Nations maternal and child health initiatives. I want to recognize and thank the First Nations Health and Social Secretariat of Manitoba for the incredible work and service they provide to Manitoban First Nations families. And I also want to acknowledge that I'm an independent senator from Manitoba, Treaty 1 territory, and the homeland of the Red River Métis Nation. The Maternal and Child Health Program, MCH, has provided culturally appropriate health and parenting support for over 18 years in Manitoba, guided by a First Nations framework that involves the collaboration with elders, families, youth, leadership, and advisory councils. The MCH is designed to support and nurture the overall well-being of children and families through strength-based relationships that utilize current evidence-based resources and traditional practices grounded in community knowledge, focusing on child health safety and nutrition, parenting practices and prenatal care, strengthening relationships within families and communities, mental health support, language and cultural practices, effective communication, increased literacy. The period from conception to 6 years of age has the most influence of any time period on brain development, behavior, and health. The effects of maternal health during pregnancy as well as childhood experiences within the first 6 years affect the brain development for a lifetime. In addition, improving knowledge of preconception and reproductive health among young adults helps to promote a healthy start to pregnancy. Since its inception, the MCH program has borne concrete, tangible results and improved the lives of First Nations children, mothers, and families. These key achievements include reduction in infant mortality rates, reduction in child involvement with child and family services, principally through the establishment of community-based supportive spaces outside of child and family services, where families in crisis can be referred to a first-line strategy to strengthen families and keep them intact. Increased father involvement and sense of belonging, enhanced family resilience, stronger parent-child bonds, and more families are staying together as a result of this program. Lamentably, the issue of maternal and child health has been noticeably absent from Budget 2024, from yesterday's economic update, and from other fiscal indicators and government investment priorities, as seen in appropriations bills such as the one before us, C-79. Despite the quantifiable and life-changing results achieved under this program, these advances are at risk due to chronic underfunding. We heard some very compelling examples from Chief Nepinak and the leaders with whom we met. The program has essentially operated with the same budget since 2013, despite expanding its operations, a widening number of First Nations communities beyond the original 14. Previous efforts to defund the program via sunset clauses were only averted due to strong advocacy led by Grand Chief Nepinak. While the program expanded to 34 communities in 2023-24, funding fell short by over $180,000, and funding has been further reduced this fiscal year, leaving a shortfall of over $360,000. Despite demonstrating readiness, 29 First Nations communities still lack access to community-based funding. Even funding proposals submitted to the federal government under Jordan's principle, which is mandated to respond to unmet needs of First Nations children no matter where they live in Canada, have been denied thus far. The impacts of underfunding this successful health program will have immediate and generational consequences for First Nations and for the entire nation of Canada. Manitoba has some of the highest rates of First Nations children in care under Child and Family Services. Shockingly, over 90% of children in care are Indigenous, and apprehension rates remain disproportionately high. In Manitoba, quote, First Nation infants are 6.5 times more likely to be removed from their birth parents, 7.7 times more likely to become a permanent ward before age 5, and 5.6 times more likely to be apprehended at birth. First Nations parents frequently face the removal of parenting rights, often without adequate access to preventative support or culturally relevant resources to address systemic challenges. First Nations, as we know, are overrepresented in the criminal system due largely to colonial policies. This widens the gap further in health inequities for First Nations compared to the general population. Studies are conclusive. Children born to incarcerated mothers are at higher risk for negative long-term health outcomes. These negative influences can increase the likelihood the child also experiences incarceration, perpetuating a multi-generational cycle of disadvantage. End of quote. These injustices underscore the urgent need for upstream, community-led programs that empower families and prevent unnecessary child apprehensions. Underfunding also slows the development, distribution, and community-based training on maternal health, such as First Nations safe sleep guides, traditional parenting manuals, breastfeeding guides, and other training and support programs that have been shown to have positive health impacts. The Maternal Child Health Program is a critical initiative aimed at addressing these disparities and ensuring families have the resources to stay healthy and to stay together. Senators, the Strengthening Families Maternal Child Health Program works to provide culturally safe parenting support, including traditional parenting techniques, and giving families the support they need at critical times, the beginning of their child's life. Accessible support that is meaningful and built on trust should not be undervalued. Such programs have significant impacts on families' ability to stay together, fostering healthier and more resilient communities and contributing to a more resilient and inclusive democracy in Canada. As the government presses ahead with its list of fiscal priorities, I urge senators to draw attention to the critical supports provided by the Strengthening Families Maternal Child Health Program, including the delivery of the services for Jordan's Principle, and petition the government to increase regional support funding and expand program activities across all participating communities. I want to just quickly note that my youth liaison advisor for Manitoba, who is in grade 12, he and I, Landon and I, went to visit the Jordan's Principal office at the Assembly of Manitoba Chiefs a number of weeks ago. We spent an afternoon with the staff. We met parents and families that were there for services, and there can be no doubt whatsoever, first of all, that Jordan's Principle is enshrined in law, and second of all, that the federal government is not keeping its promise. There are both delays and underfunding of Jordan's Principle programs, in addition to the many other programs to which I've referred in my speech today. This is the opportunity for us as senators to stand and to respect the memory of little Jordan River Anderson of Norway House Cree Nation, who died because levels of government refused to put his survival as their priority and instead squabbled over who was going to pay the bill. And we are probably facing similar situations if there is not a resolution to both the underfunding and the more effective coordination of the desperately needed and entirely justified funding for maternal and child health programs for families and children of our First Nations. Thank you so much for your attention. Merci, Megwich.
Senator Cardozo, you have a question?
Will the senator take a question?
Senator Cardozo.
Thank you, Senator McPhedran. You and Senator McCollum have talked about in the last few minutes the long-term funding to communities for families and for maternal and child benefit. I really appreciate your taking the time to go through the supplementary estimates, the most exciting documents that are ever tabled in this chamber, and going through them with some detail and telling us about them. Could you say a little bit more about the importance of long-term funding, and why that doesn't happen and why it's important for it to happen?
Senator McCollum.
I truly wish that yes, thank you. I know we get mixed up all the time. I truly wish we could answer the question as to why this chronic underfunding. These are clearly broken promises. And the fact that the underfunding is chronic means that not only can the programs in existence not be adequately maintained, but the programs that need to be rolled out, that are ready to be rolled out, cannot even begin. The statistics are very clear. We are way behind the goals that were agreed upon in terms of services to First Nations and thereby delivering the metrics on increased health and capacity of children, not to mention, under Jordan's principle, the absolutely critical health care that children in crisis need. This is the whole idea behind Jordan's principle. So the fact that we see this chronic underfunding, including in this bill, is a telling reminder for us that reconciliation is more than words. Reconciliation is action and following through on promises that currently are not being kept.
Senator Cardozo.
Thank you. If we can take one more question. So just, I'm a bit confused. We've gone through the process of the agreement that was signed between the Government of Canada and I'm going to get the name of the organization wrong, the Child and Family Welfare Council, headed by Dr. Cindy Blackstock, and subsequently the Assembly of First Nations has rejected that agreement. But that part aside, have we not dealt with that now, and haven't we got that straight? And are we still making the error in the level of funding?
Senator McPhedran, you have a minute and a half.
Thank you very much. Yes, we're still behind. Yes, we're still continuing the mistake. And yes, First Nations children and their families continue to suffer as a result of this inaction.